event, which I'll be moderating. I'm Bramley Jeffries, the education editor for BBC News. My remit involves far more than what happens in schools. We're also very concerned with the lived experience of young people. And throughout my career as a journalist covering various areas of social policy, that has been at the heart of the work that I do, both listening to people and to the data that captures their experiences directly to inform what happens in how public services and public debate is shaped. This event is happening thanks to Pro Bono Economics. They're partnering with our Wellbeing, Our Voice campaign, alongside the Be Well research project, which we'll be hearing about in a moment, the Children's Society and the Fair Education Alliance. You've all had a chance to get teas and coffees at the back. Please do stay on at the end to discuss further, and we will have time for questions at the end. And welcome also to the people who are joining us online this morning. To get our discussion underway, I'm going to ask for some opening remarks from three speakers. Jack O'Neill, Director of Policy from the Children's Society, Gina Cicerone, the Chief Executive of the Fair Education Alliance, and Mira Sarabanian, a Be Well alumnus. Jack, if I could ask you to step up first and to speak.
Yeah, thank you, Bramley, for the introduction. And thank you all for joining us here today as well. Today's a really important day to bring together stakeholders, leaders, supporters, beneficiaries, and hopefully a couple of intrigued minds into the importance of the national wellbeing measurement. For many of us, we've been on this journey for a long period of time. Children's Society, this journey started 20 years ago in 2005 with the establishment of the Good Childhood Research Programme. And that research programme essentially asked the question of how are young people doing in their lives? But rather than assume, rather than observe, rather than ask adults, it was rooted in actually asking young people themselves to understand how they felt and to basically inform both ourselves, partners, adults, and wider society how young people were feeling and what we need to do about it. That then evolved into the Good Childhood Index in 2010 and now the annual publication of the Good Childhood Report. And through all of that time, what's become abundantly clear is the imperative need for a national initiative to take the reins. I know that lots of people in this room have similarly been on those journeys. So, as was mentioned, we'll hear about some of the local leaders who have been, really spearheading these programs in different areas across the country. Others have joined the call for this policy initiative, and also others are acting on the data that we do have to make the difference to young people's lives here and now. And we're now at a really important and critical juncture of this journey with the establishment of the Our Wellbeing, Our Voice coalition. And I think we all have this shared appreciation and ambition, but also a recognition that the time for action is now, and the opportunities that lie in front of us have to be grasped, else we miss another critical opportunity to place young people's wellbeing at the heart of our government and all of our society's efforts. And the truth is, we are in a happiness recession. As hopefully you'll be able to look through the booklets on your seats, the data that we do know is stark and it's concerning. And young people's well-being is the lowest in Europe. And when we look across the past decades, it's been in decline in various aspects of their lives, but also their life as a whole as well. But I don't want to be too doom and gloom, because as I said, I think the opportunities are there. And we all know that everyone in this room has the shared ambition to place young people's well-being at the heart. And I believe and hope that today is a useful place for us all to discuss, share ideas, and hear some of the expertise from our panel. And lastly, I just want to say that the benefits of the National Wellbeing Measurement Programme won't just be felt in any one singular government department, government mission, or area of society. And in the same way, the responsibility doesn't just lie with one government department and mission as well. It's responsibility of all of us, of all of government to show leadership, and all of us to keep pushing for that so that we can really deliver for young people. So I'm delighted that you've all chosen to join us today, and equally delighted that we'll be hearing from some expert speakers on the panel and hopefully continue the discussion afterwards. So I'll now hand over to Gina, the CEO of the Fair Education Alliance.
Thank you so much. And good morning, everyone. It is a pleasure to be here. I'm Gina Cicerone, the CEO of the Fair Education Alliance, and we have many of our 300 member organizations here in the room today, from civil society, business, and education, because we work together to tackle the root causes of educational inequity. And it's our pleasure to be a co-leader on this campaign to ensure that we have a national measurement program for children and people's well-being. And we know, as we've just heard, that the situation is very challenging. You might have seen the recent report from Who's Losing Learning Coalition, and what they've shown is that the number of lost learning days has nearly doubled from over 6 million lost learning days in 2019 to nearly 12 million in 2023. That's for a variety of reasons, and we see well-being at the heart of all of those. We're talking about timeouts through to permanent exclusions, and we need better data to understand why we're losing learning and how we can best address that together rather than in silos. We also know that we need to act now, and we need to act now with young people. They're at the heart, and Rhona, it was great to hear you say that lived experience is so important. We're delighted to have 4 of our youth steering group members here today, so please do come chat with them afterwards. And this program would put lived experience of children and young people front and center in terms of their own insights, but also in terms of the policymakers, and in terms of their data and their own experience, not just about exam results, but about the totality of their experience is highlighted on this national level. And so on that note, I'm delighted to introduce Mira Sarabaman, who is one of the former youth steering group members of Be Well, and has been a part of creating the Be Well movement since its inception. Thank you.
Hi everyone, I'm really excited to be here today and to be talking to you all. I'm Mira, and I'm currently finishing up my undergraduate degree in politics. Before I started university, I was actually one of the first young people that you said who was involved in Be Well. So I had the chance to sort of be involved in the creation and also got the delivery of the program. And that's something that I've been so proud of since the very beginning. I was born and brought up in Manchester, and that's something I'm also so incredibly proud of. Growing up in such a diverse and activist-led community has become so central to who I am and it is to my childhood. I've been involved in youth activism and youth voice initiatives since I was 11 years old, and 10 years on, I'm still striving to make sure that young people can find their voice. At a certain point in time, many of us were fighting to be seen and to be heard. We felt like we had been sidelined, and I felt many times I didn't even have the adequate support to voice the concerns that I felt many other young people felt across my community. I was frustrated with the system, and many of us spent our time waiting for someone to ask us a question, but then at the same time actually listen to our answer. This all changed when I met the team at Be Well. My involvement started about 4 years ago, and I was asked to provide insight on what it was like being a student in Greater Manchester. I was able to use the experience to draw upon my own experiences with mental health provision, but then also discuss and describe the experience that I had in school, but nationally at the time. The space in front of me was safe and welcoming, and for the first time, I felt as if I was taking part in something that was meaningful, but also the people who were key to actually make a positive difference. I fondly remember the discussions that we had at the beginning, from naming the programs, picking out the logo. Young people are at the centre of every single one of the decisions, and I think that's what makes Be Well what it is to me. I felt so proud to be a part of Be Well. I felt so proud that this was something that was coming out of Greater Manchester. But most of all, I was so moved by the idea that young people were finally getting listened to. I believe that Be Well has been so impactful because at no point did it ever feel like young people were an afterthought. No idea felt too far out of reach. Even when I asked if we could get a wellbeing bus that we could drive around the county. Seeing ideas come to fruition like this shows that we were actually getting taken seriously, and it was important that Be Well was about celebrating young people, and that their mental health wasn't something to be ashamed of. And I think it's this idea that really remains powerful today. I've always believed that young people should be involved in decision making, especially when those decisions are going to affect them themselves. I appreciate the fact that I'm no longer a young person that's going to be able to see the effects of Be Well firsthand, but I know that this fight's so great because the next generation of young people are still being championed by Be Well today. Across the country, young people are calling out to decision makers, and now's the time to continue to foster those relationships. Over the years, I've noticed that there seems to be some misconceptions about young people, that we aren't smart enough to be here, that we might not express our thoughts eloquently enough, or that we just don't have enough experience. I think that this belief creates so many barriers to youth engagement, but none of it's true. Young people bring a perspective that is so needed, and I believe that young people of all ages have important things to say, and arguably the most important things to say. There have been many conversations that I've had with family and friends about how I wish that mental health was spoken about more widely when I was at school, that we all have the support and opportunities that we so desperately needed. Because the reality is many of us actually struggled in silence. A national wellbeing measurement programme is crucial to address this and ensure that the young people of today won't face the same struggles. A national programme will continue to destigmatise the topic of mental health, and having data is so beneficial to proactively making change, and having tangible data that highlights young people's well-being isn't just needed for policymakers, but for the young people themselves. I think it has the ability to make young people feel less alone. It shows them that their struggles are shared and understood. A national wellbeing measurement programme will shift priorities, not just in schools, not just in neighbourhoods, but across communities too. It would improve access to resources, reduce stigma, and help create a society where emotional well-being is prioritised. And just like Be Well does, I believe that we need to actively listen to young people, value their opinion, and action meaningful change. And by doing this, I truly do think that we can build a future where young people's well-being really is everyone's business.
Thank you, Mira, for that fantastic contribution about how much it's meant to you to be involved in the Be Well project, which we'll be hearing more about. Let me introduce our panel for this morning. Manira Wilson, the Liberal Democrat education spokesperson, and MP for Twickenham. Manira, if you'd like to come up and join me on the panel. So, Sue, head teacher of Manchester Communication Academy, apologies, who's going to be bringing her lived experience of dealing directly with young people in schools. And Neil Humphrey, Professor of Psychology of Education from the University of Manchester, who is leading the Be Well research project. Professor Humphrey, I'm going to start with you. Be Well has now been underway for a number of years in 2 areas of England, capturing extraordinary first-hand data about the lived experience of young people and their mental health and well-being. Can you give us an overview of what your latest findings are and what that tells us about where we are?
Yeah, thanks. Good morning, everybody. So I wanted to start just by giving you a sense of the scale of the data that we've collected in Be Well. So in the last 4 years since the project started, we've collected data on over 135,000 young people from around 300 schools in our 2 locations. Put that in context, in Manchester we have 2 magnificent football stadiums, the Etihad and Old Trafford. It's enough to fill both of those stadiums with a little bit left over on the side, which incidentally would be the first time City have managed to fill their stadium. Apologies to any City fans in the room, it's true. So, I mean, in terms of like key findings, where do I start? The first thing I suppose I would say is if you haven't been on the Be Well website, please do go on there. There's data dashboards for you to explore the data for our 2 regions that we work with. There's a series of blogs and reports and journal articles and headline findings that really kind of get into way more depth than I can possibly do in the next minute or 2. But just to give you a sense of some of the latest data, in terms of some of the kind of key mental health outcomes, one of the key things that we focus on is young people's emotional difficulties that they experience. And we know from our data that about 1 in 7 young people are experiencing emotional difficulties that are at a level that would warrant some kind of professional intervention. That's far too many young people. The numbers come down ever so slightly since we started, possibly as a result of the impact of the pandemic kind of waning away, but it's still far too many young people whose mental health is a significant cause of concern. We know young people's life satisfaction. We use the Office for National Statistics life satisfaction measure. Young people on average are kind of scoring at around 6.5 out of 10 in terms of their life satisfaction. But we can see significant inequalities beyond that kind of average. So young people from more disadvantaged backgrounds score a lot lower on that measure. Young people who are part of the LGBTQ plus community score a lot lower. Young people with special educational needs score lower. So we can see when we go beyond the average statistics that there are significant inequalities to be addressed. And those inequalities are kind of fairly stubborn as well. We've got 4 years worth of data in Greater Manchester now. And the gaps that we see, particularly around the LGBTQ plus young people, are really not shifting. They're very stubborn, and there's much more that we can do to address those. Other key findings that we're looking at, we're really interested in where young people grow up and where they learn. And so we're doing work around the effects of neighbourhoods and characteristics of neighbourhoods, and some really interesting stuff there that we're just writing up at the moment around how neighbourhood impacts young people's life satisfaction trajectories. We've been doing some work around how school context influences young people's likelihood to take substances, including vaping, but also kind of illegal substances. And then finally, we're kind of looking at some of the key drivers of mental health and wellbeing. So we know from our data that nearly half young people are reporting not getting enough sleep to feel awake and concentrate in school. I'm the father of 3 children, one of whom is a teenager. That's no surprise to me, but when you see it on the scale that we have and young people saying they're not feeling awake enough to concentrate in school, we know that's a major issue. Only about a third of our young people are meeting or exceeding the CMO guidelines on physical activity of 1 hour or more a day. It's way worse for girls than it is for boys. It's only about a quarter of girls, so we need to do a lot more to make physical activity accessing, appealing and engaging for our girls. We know that 1 in 10 with our latest data, 1 in 10 young people are experiencing food insecurity, so they are not getting enough food and the family can't afford to get more, so they're basically running out of food and going hungry. We know about 8% of young people are isolated. They get internally excluded in school at least once a week, and on average are spending about a day out of lessons. So coming back to that question of lost learning, we've got a significant proportion of young people who are losing significant amount of learning, even though they're not formally excluded from school. And then finally, about 1 in 5 young people are not accessing the arts, culture and kind of entertainment offer and provision that's available in their local area for reasons which are partly to do with barriers, but also to do with kind of access and inequalities.
I think one of the very striking things about what you've drawn out for us out of that hugely rich data is also the importance of holding in mind different groups, that we should not aggregate young people as one group. There are going to be many different experiences within that, and I'm sure we'll get to that in our discussion. Sue Otler, as a head teacher in an area of really quite extreme disadvantage in North Manchester, how can teachers respond to this picture, which I'm sure is very familiar to you from what Neil is saying?
Yeah, absolutely. Morning, everybody. Everything Neil said completely resonates with me, but the first thing I'll say is that I'm lucky enough to serve the most gorgeous children in the most wonderful community. I say that now, I'm sure somebody's pushing somebody's buttons right now. But they are gorgeous. But everything that's been discussed is what we see each day. We have families that are in real poverty, I mean real poverty. Children that come to school that are in food poverty, may not have eaten, don't know where that next meal is coming from. We have a high proportion of children who are facing issues around housing, around homelessness, sofa surfing. I know as a school leader that my number one safeguarding referral is all around mental health. It's the number one thing that is raised every day. We have issues around social media, which I'm sure we're all too familiar with, as well as challenges around physical health that some families face as well. Now, I'm not trying to paint a doom and gloom picture. We just need to have, a reality check on where we're at. And as school leaders, on my accountability measures, I'm asked to produce results that are crucial and I believe in, but that at the moment seem to be ignorant of all those other issues that we're facing and that the young people are facing, the families are facing. But we are in a unique position to do something about that. First of all, because we've got an audience, we've got a captive audience, and we are those community hubs. Our school never shuts, the doors are always open. And there's a way in which we can work with partners much more effectively to try and combat some of these issues, or to take the best next steps to support young people in knocking down all of those barriers so they can come to school of a morning, feel excited to learn, have the platform to learn, and really enjoy that educational experience. Schools can be community hubs, but school leaders don't have all the answers. You know, I'm often told to stay in my lane, and I understand that. But I've got an audience, and I've got young people, and I've got families, and I think we can work much better together to try and overcome some of these issues.
And as you say, when you're thinking about the challenges of these young people, there's hidden homelessness is one of the things that doesn't get mentioned perhaps often enough. We hear quite a lot about food poverty and about some of the pressures on family incomes, but there are other pressures which put extreme stress on young people's mental health.
They do, and again, this is a lot about partnership working and school leaders. We'll come on to this more in a bit, but this data is crucial that school leaders understand the scale of those issues so that we can make some strategic leadership decisions about where to place our funding and our best bets. So I have a family partnerships team that works specifically looking at some of these issues, that are trained up in some of the matters around housing, and they can act as an advocate and work as a conduit between other services and families. That's not necessary everywhere, but it certainly is for me in my contacts and the children that we're working with. Because how can I be asking a child to come in that day to sit, to learn, when we don't know where they've been the night before?
We hear a huge amount in this public debate, particularly around lost learning, around academic attainment and the progress or not that England is making compared to other countries. Minerva Wilson, what can MPs do to shift the debate away from that more narrow focus on academic attainment? Important is again jobs and employment, and we should remember that, but to the broader lived experience of young people.
At its core, I mean, obviously, we all, as politicians and policymakers, and also I speak as a parent of 2 young children, are very concerned about academic standards and attainment, but that's got to go hand in hand with good well-being, because if a child or young person doesn't turn up to school happy, healthy and ready to learn, they are not going to thrive and they are not going to reach their full potential. And given the stats we've heard today, and that many of you are familiar with, there are vast numbers of our children are quite obviously not reaching their potential. What impact does that have, not just for those as individuals, so there's that moral question, but our whole society and our whole economy? I mean, we've got, every political party is talking about growth and how we can turbocharge the economy, but actually, our biggest, most important resource are people. We are not investing in properly, and if you're only focusing on their grades, important as they are, you are not going to get the very, very best out of them. And I think we as MPs, what we can do is bring those stories from our constituencies that we get day in, day out from talking to parents, young people and school leaders, but use our platform in Parliament and in the media to make the case, sharing those stories, sharing the data that's being uncovered, and making the case, as I have tried to do day in, day out since I got elected in December 2019, because I remember being quite shocked from very early on the stories I was getting from parents in my inbox about the help their children needed and that they weren't accessing, which is one of the reasons I focused so much on children's mental health in my time in Parliament. It's by bringing those stories to the fore that we can really try and change that narrative. And actually, my sense is more and more as I talk to parents and carers, that they are just as interested in wanting to ensure that they find a school or college that will focus on their children's well-being and happiness as well as academic results.
And of course, you've proposed an amendment to the children's bill to put that national focus for a measure of well-being at the heart of thinking about children's future.
Yeah.
What's the importance of that amendment, and what's the thinking behind putting forward the proposal for a national measure of children and young people's wellbeing? So the bill is actually called Children's Wellbeing and Schools Bill. One of the things I've said consistently every time I've spoken on the bill is that actually there's not much about children's wellbeing in the bill itself. So I think it's slightly mislabeled. So I and a number of other MPs have sought to insert amendments that actually focus on children's wellbeing, and the wellbeing measurement is one of them, because as we've heard, it provides such powerful, rich, important data that enables people who are at the coalface delivering services or leading schools, but also policymakers in Whitehall or in local government, to be able to work out what they should be prioritising, where they should be spending their money, and how they can get best bang for their buck. And most importantly, putting children's voices at the centre of that. As a liberal, my whole thing is about empowering people and communities and making sure that we're harnessing people's voices and views. And so for me, putting children's voices at the centre of that policy making is critical. And that's why the children's wellbeing measurement not just measures their well-being, but is also hearing from children themselves. There are lots of other data sets. Actually, our data on children's mental health is quite fragmented. In the last Parliament, I tried to propose a bill that would actually bring together lots of different data sets into a national report once a year. But again, service providers, on the data they are collecting when children present themselves to certain services, actually having a national measure that's rolled out across the country with some local flexibility so that schools can adapt it and can adapt it to their needs, would help to bring national level data to the fore to tell us actually how our children are feeling about the way we are treating them and educating them.
There's something interesting there, isn't there, about the importance of local and national. Neil, you were talking about how you're beginning to look at neighbourhoods. Maybe we might get onto that in a moment, to actually have that granular sense of, what is it that shifts the dial for young people to experience. When you look at the data we have about young people's wellbeing nationally, what do you see, and where are the gaps that some kind of national measure could fill?
Well, the main gap is that we don't have a truly national data set. I think that's the kind of really important thing to kind of reinforce here. So there are, as Manira said, there are a number of different approaches taken, Be Well being one of them. There are a handful of kind of cohort studies that are undertaken, but they don't do the same job as a truly national system would do. The kind of the power that would give us to actually act for positive change for young people, if you have every school in the country undertaking this kind of approach, and as Mira said, a kind of some standardisation, but also some kind of modularisation so that we can adapt to kind of local needs and priorities. The power of that kind of data set would be absolutely incredible. And as a thought experiment, if you think about the data that we do have national data on, things like the National Pupil Database, so routine data on academic attainment, children's attendance in school, suspensions, permanent exclusion, and so on. Imagine for a second if schools were not collecting that kind of data. How would we make sense of our education system and things that we're doing well and not so well for young people? So the gap at the moment is we just simply don't have that for young people, and all of the data. Think about what we collect in Be Well. We're interested in wellbeing and mental health, but we're also interested in all the things that young people have told us actually drive those things, so we can get a real sense of where are the kind of opportunities to kind of shift the dial. So it's not just about collecting the mental health data, it's about collecting the data on the things that we know from what young people have told us impact their mental health.
And, when you put it like that, in some ways there's a very stark contradiction, isn't there? Because actually the National Pupil Database is an extraordinary data set that's pretty much unique globally in terms of how we look at and measure and track children through the education system. And yet there is nothing alongside that which looks at what's happening in their lives and how they're experiencing it. And particularly important perhaps after the pandemic. Are you seeing a shift in your data in the last year or two, reflecting some of what we know has happened as a result of that?
We have indeed, and I mentioned before the kind of slight shift that we've seen in terms of young people's emotional difficulties. That's kind of dropped slightly since the pandemic, but again, still way too many young people who experience significant difficulties. But also, which I think, again, trying to kind of include the positive as well as the kind of challenges here. One thing that we've seen with our Greater Manchester data, where we've actually got data that goes back before the pandemic because of some of the surveys that were done in Greater Manchester before BWell came along, young people's sense of hope and optimism for the future. The data pre-pandemic for that was really positive, and then the pandemic hit and it took a nosedive, and it's just now over the last 2 years, it's just recovered to kind of pre-pandemic levels. So there's some, kind of green shoots of optimism in there about how, because we're now like 5 years on since the initial lockdown, right? So it still feels like yesterday to me, but it's there's signs that on those sorts of indicators, the immediate aftermath of the pandemic is starting to kind of wash away. But having had that experience, there's still many young people who are experiencing significant challenges in their lives, and that was the case before the pandemic as well. So the kind of the attenuation of things from the pandemic doesn't draw away from the major challenge that we still have to face.
And so, I go into schools all the time, and they're still dealing with some of the legacies of what happened from COVID, like the attendance issues that we've heard about this morning, the seismic shift we've seen in that. Given what schools are already doing to support their communities, what would you say to fellow school leaders who might sigh at the thought of being asked to gather more data, engaging more work around well-being? Is it possible for schools to do? And what are the dividends that you see in it?
I think there's a couple of points here. I want to pick up what Neil said about, all the measures that are in place at the moment, attendance data, suspension data, permanent exclusion data. In a way, there's no point in measuring all of that because it's not giving us the cause. We're looking at the symptoms, not the cause. So if we're going to look at those measures, we need some sort of wellbeing measure to look at it alongside to say, okay, what is it I need to be tackling? In the absence of that, school leaders working blind because we're trying to come up with, the next whiz-bang approach of how I'm going to drive this down, but without actually understanding the fundamental cause. So we need to look at them together. It can't be looked at in isolation. And I think in the absence of a call for a measure, then we're making that difficult for school leaders. I think the concern for school leaders is whether having a national wellbeing measure in schools is another accountability measure, another stick to beat school leaders with. Sorry to sound dramatic, but it could be perceived in that way. I don't feel it's that because, but it all depends how it's used. I would love people to come and speak to school leaders and ask, do they know what's happening within the school? Do they know what the voices of the children are saying? And what is it that you're doing about that? There's no way that a school leader can resolve a mental health crisis within a community, but they can say, I understand the scale of this issue. I've heard from those that are feeling it, and these are the first steps that I'm taking to try and do something about it. It shouldn't be that we have to demonstrate a shift in those measures over time, because that's not going to be possible. And it's, there are so many variables that contribute to these measures, but it's having the understanding of, I understand what is happening in my community, and then therefore I can do something about it. And it's been invaluable to me as a school leader. And it does help me make some appropriate decisions. If it makes me decide if I'm going to invest in an academic intervention to bring about improvement in girls' reading, I'm making this up, but imagine that's what it is. When really what I should be looking at is looking at girls' physical activity levels, investing there, and actually it will bring about the same result. And I think that's where we're misfiring a little bit. And I feel in some cases when I get this data back, I'm like, oh heck, I didn't know that. But brilliant. Not brilliant that the data's bad, but brilliant that I now know, because now I can do something about it. Otherwise we're operating on assumptions, and that's not right. But then also I see this data as the children marking my homework. I've invested in this mental health strategy. Well, how do I know if it's having the impact that I want it? Because I'm still getting the referrals in, okay. But then through my BWell data, it's showing me that the children at my school have better than average psychological wellbeing scores. Right, well, okay, that's a green shoot. That's a green shoot showing me that we're on the right track, we're on the right path. And the data is one thing. Having the data is crucial. We're all better if we're informed, but it's what you do with it that's key. Data will only take us so far. It's the action that's critical after that. And I think those are the conversations that should be had. Not, this was your measure now, this was your measure. Forget that. Tell us how you've acted. Tell us what you've learned from it. Tell us how the young people are benefiting from that.
That's a really important point, isn't it, about any data collection being around having an informed conversation and evidence-based interventions, rather than adding further to the accountability burden of schools. And there isn't that a danger that if something was in existence, that schools might begin to feel it as an additional pressure, particularly in the most disadvantaged areas where they are already perhaps feeling harshly judged on attainment.
I recognise that it would be seen as additional pressure. I'm sure this is not the case for Sue, but I think often, unless you're measuring it, something may not be prioritised. So because of all the various accountability measures there are in the system, we know that school leaders tend to really focus on making sure that they're doing the right thing to meet those measures. If actually there is a wellbeing measure as part of those suite of measures that they're being asked to submit data on, I think it will be taken more seriously. So I think it is an important additional extra, but we need to introduce it in a way that, yes, isn't too onerous for schools. And I know that certainly when we were debating this amendment of the bill, that was one of the concerns that ministers put forward, was about how onerous it is. But I think from what we've heard from Sue already is so many schools tell me that they feel like they've become the fourth emergency service. They're having to provide so much additional support and care beyond just educating children, because of social services struggling, because children turning up to school hungry or being in awful temporary accommodation. And so we're putting more and more onus on schools, rightly or wrongly, to do some of that additional work. I think it's only right that given the role they have as a hub of the community, that we're also using this opportunity to understand whether the things they are doing are the right interventions. And hopefully that might make people sit up and listen and recognise that there are other additional services needed in the community that perhaps schools shouldn't be forced to provide, or that they're resourced better to be able to provide.
So how do you think a national measure would help, given that it would be schools gathering the data, help shift that focus to the broader burden that schools describe that they're meeting, from not being able to access housing support for families, perhaps not being able to access support around some safeguarding issues within social services, not being able to access often CAMS help for children who are in real mental distress? Well, I mean, at the national level, then I would hope and expect that national level data would be a wake-up call to policymakers and ministers sitting in Whitehall about some of the interventions that need to be taken at a national level. But a lot of the things you talked about can also be addressed at a local and a regional level, and that's where that data is so important to be able to affect what's being done at the local and regional level. But I just picked up on a phrase that Mira used. She said, when children's well-being is everyone's business. I wrote it down because it really stuck with me, and I might quote it at some point if that's all right with you in the House of Commons or somewhere else. But I think that's what having this national measurement with that local variability will make children's well-being everyone's business, because we can't afford not to do this.
Neil, in your work already, are you seeing things which are surprising and which are not captured or measured elsewhere because of your focus on putting young people's voices at the centre of what you're doing? We've heard from Sue that she's getting useful insights, but what are you beginning to see in terms of what matters to young people?
Well, if I just give an example, which actually was going to be in response to something Sue said, that shows really how powerful this data can be. So Sue talked about, if we've got the data on things like attendance and exclusions and attainment, but we don't have anything about the cause, we're treating the symptoms and not the cause. We're in the process at the moment of, we've linked data from so we've got young people's perspectives from the BWell survey, and we've linked that to data on their attendance. So we're able to start looking at, when young people are following what we would call troubling attendance trajectories, their attendance is, declining over time, or it's low to begin with and carries on being low. We can start to actually understand, by linking those data, what are the kind of drivers, so actually getting to the cause rather than just looking at the symptoms. So we're able to start seeing, and this is only preliminary, but we're looking at things like, for example, young people's sense of belonging to school. That's a really key driver of which of the different attendance trajectories we've identified they follow. Whether they are experiencing mental health difficulties, again, is a key driver. So young people that are reporting high levels of emotional difficulties, much more likely to have declining or very low attendance patterns. Young people who have better relationships with school staff are more likely to come. I mean, these are all probably going to sound really quite obvious, but we've got the data now that can actually show that these things are kind of connected. The really, I think, one that's kind of stuck out in this preliminary analysis that we're working on at the moment, but that really stuck with me when we were discussing it the other day, is one of the things we asked young people about is whether they've sought and received support at school for their mental health. And young people that say yes to that question, so we don't get a huge amount of detail on exactly what that support looked like, but we just get an indication, have they used school as a way to access support for mental health? Young people that say yes to that are actually much more likely to follow the kind of attendance trajectory that we would want to see. And that's really pleasing for me, because what it's telling me is that what schools are doing, and it will be a whole variety of things, but school feeling accessible to the young person for wellbeing support is helping them to feel that that's a place that they can go and be a learner there, that it's somewhere that they can belong and get the kind of support that they need. So there's all kinds of things there, but there's some worrying things as well. So we look at the characteristics of young people and those different attendance trajectories, and the children with special educational needs, if they have an education, health and care plan, they're about 8 times more likely to follow one of the kind of troubling attendance trajectories where their attendance is way lower than it should be. Children from more deprived backgrounds. So again, it shines a light on these inequalities, but it also gives us an indication of where we can start to make some changes that might then impact on their attendance.
So how do you find the headspace to think about this alongside all the accountability measures?
I find it interesting that people ask that question, to be honest, because I think you'd be hard pressed to find a school leader who doesn't want their children to be safe, happy, healthy and loved. And if you ask any school leader why they got into it, the answer won't be because to get cracking progress aid measures. The answer will be it is simply to love children and to look after them. So if those school leaders, it's hard because of all those accountability measures. It's hard to have that brave leadership, but you've got to come back to your North Star, haven't you? And if children are safe, happy, healthy and loved, then they stand a better chance and everything else will follow. But like I say, you can't work blind. And we talked about measures before, and I agree. Some school leaders don't measure things unless there is, some requirement around that. But there's that important saying, measure what you treasure. And if we really, really do treasure children's well-being, then we should be measuring it.
Linda, if you want to come in on
No, it was just to pick up on a couple of other points. I mean, on school attendance, there's a massive issue that I think government's really struggled with. So to come back to your earlier question to me, how is this helpful nationally? There are some big policy conversations happening around school attendance, but also at the moment around online safety. I was touched on this earlier. You talked, Neil, about lack of sleep. We know a lot of that is linked to kids on their screens until late at night. If we're going to be making big policy interventions, looking at there are all sorts of discussions about whether we should ban phones altogether for under 16s, and there'll be a whole host of different views in the role of ban social media. If you're wanting to take those sorts of massive policy decisions, having national level data that actually hears from young people, because I think there's an assumption that young people don't want some sort of regulation around social media and more intervention on online safety. Actually, when we talk to young people on a one-to-one basis, that lots of them do want us as policymakers to be taking greater measures. So to help inform those big policy interventions, but also big items of expenditure. I mean, this government does say it's committed to providing more mental health support in schools. My own party has campaigned on that for a long time. If we want to actually measure the effectiveness on that, of that, hearing from young people right across the country who are getting different levels of support as it is at the moment, is really important for us to know, well, are we rolling this out in the right way? Do we need to change track?
And one thing that all three of you touched on actually is the importance of making school welcoming and appealing. That it's a place that feels safe, that feels welcoming, and where you can have a safe dialogue with adults who are going to act in your best interests if you raise a concern. There's that push-pull factor, isn't there, with school. We have a system at the moment with sanctions for parents, but possibly what you're all saying is not enough thinking about beyond a school level. I know schools are thinking intensely about how they make schools a welcoming, safe place, and are working with individuals and also thinking about their school cultures. But maybe there's some broader lessons there as well that national data sets could help with. You talked about a modular aspect, Neil, and I'm interested in how that ties to your thinking about neighbourhoods. So there's the potential to shift a national policy conversation, but also what's the importance of having some element of locality within that?
Well, I mean, I think what it comes down to is, so it's partly this idea of making wellbeing everybody's business. So this isn't just the responsibility of schools. So if we only focused on schools and what's happening within the school gates, then we're only ever going to get, you know, a partial response. So part of the emphasis here is actually, with having neighbourhood data as well as kind of school data, is to actually broaden out that. And our neighbourhood dashboards that we have in both of our locations enable a whole range of partner organisations that work to support children and young people to be able to look at where they can kind of target resource, things like that, where the areas of greatest need are, but also look at like which neighbourhoods are actually you know, where young people are thriving despite significant challenge as well. So again, it's not just about, you know, the kind of doom and gloom story. There are some neighbourhoods in both of our locations that are, you know, you would expect based on levels of deprivation and other factors to be doing really poorly in terms of well-being, but there is something about them that then we can learn and look at whether that's transferable. We ask young people about what it's like to live in their local area. So we ask them things like, you know, whether people in your local area look out for each other. We ask whether they feel safe in their local area. We ask about levels of trust and other things. And what we're finding with those data is those are kind of key drivers of young people's well-being. So again, it's not just about what goes on within school. It's also about where you live as well as where you learn. And again, having that data and being able to kind of, you know, essentially we just have, it's the same data, we just chop it up in different ways. So we can look at, you know, these 200 kids, do they go to Sue's school? But then also the same 200 kids, we can look at, well, where do they actually live in and around the neighbourhoods around Sue's school, so that we can start to look at, you know, community action that can be taken as well. So again, it's part of that kind of having a much more holistic picture and not just saying this is yet another job that's just for schools to do.
There's important thoughts in there about a community cohesion and maybe even the physicality of housing design, amenity spaces, safe spaces for young people to be and spend time together that are local to them and cost-free.
Absolutely. So on the kind of housing side of things, again, one of the analyses we're doing at the moment is linking publicly available data on the indices of multiple deprivation, which includes information about housing, and we're finding that essentially, again, probably unsurprisingly, but neighbourhoods where there is poor quality, unsafe housing, that directly predicts lower levels of life satisfaction over several years for young people. But then also the kind of the community cohesion element. We talk about the kind of relational aspects of neighbourhoods. So important. You know, young people are spending time when they, you know, they're in school most of the time, but when they're not in school, you know, they're out and about in their local neighbourhoods, and that context is just as important, in my view, as what goes on in the kind of 6.5 hours that they're in school every day.
We have seen over the last 15 years a loss of some amenities for young people in localities.
community centres closing, youth centres, a reduction in youth workers. How do you create the possibility for young people to ask for things which they may not have the experience of having access to, they may not have seen in their local community?
Well, I mean, it's really challenging. You know, if I think about my local area, so I'm from Oldham, what the youth offer looks like now compared to what it looked like when I was growing up, it's an entire world of difference. Where we can play a role with the kind of data that we can collect is we ask one of the questions that's always been in the Be Well survey is, are there good things to do in your free time in your local area? And then when we map that geographically, we can start to see, you know, where are the areas of greatest concern? Where are the areas where young people feel there's absolutely nothing for them to do? That's then when we can look at kind of targeting, you know, what are admittedly always going to be scarce resources, never going to be enough resource to go around. But with these kinds of data, put at the neighbourhood level, we can start to look at, well, where are the areas where we need the most investment? And then we can do the kind of consultation with young people outside of the survey, but working with young people like Mira and others to say, well, actually, if we were to change things here, what would you want to see that look like? What would work for you as young people? And that, you know, so again, it's using the data to create change on the ground.
So it looked as though there was a thought forming there for you.
I just couldn't agree more, because I think in the area in which I work, we're not short of investment. And to be perfectly honest, there's a lot of investment into the area. But where it goes wrong is when it's a done to approach rather than done with. So the point about that consultation and speaking to the young people who are the end users, it needs to occur. And it is, again, like lived reality for young people now. I don't think any of us can, well, Mira's probably the closest to it, but any of us can understand what that is. So are we best placed to make some of those decisions about what is going to work for them? It really does need that consultation, and we need to listen to what that is, because, you know, it's very different from when I was young, and I can't pretend to assume to know what it is that's needed. So it needs to be done with, not done to.
And I think just to pick up on that as well, I think the really important bit is not just consultation with young people, but I think we need to think about which young people we consult with. There's a brilliant arts and culture offer across Greater Manchester. You know, it's a city region that's known internationally for its arts and culture and creativity. So there's an infrastructure there in Greater Manchester, but our data shows that not all young people are accessing that. So even when there is something there are some young people who feel it's not accessing or appealable to them. So I talked before about young people from the LGBTQ plus community, young people with disabilities. Our data shows that they're much less likely to access resources and facilities, even when they're there, and sometimes even when they're there on their doorstep. So we need to consult with young people who are traditionally marginalised or sidelined or excluded to get a sense of, you know, how can we make this kind of offer, this youth offer, appealing to everybody and not just the kind of quote unquote average young person.
And I think really you touched on, you know, one of the sort of fundamental questions around all of this. The campaign is called Our Wellbeing, Our Voice. How do we ensure that young people could really drive it? I loved hearing from Mira, for example, that nothing was, for Be Well, there was nothing that was ruled out, as long as it was affordable and manageable. How do you get that sense of agency into a national measure?
So don't forget politicians. We're terrible at talking to young people. I think that's right.
Yeah, we could. I find it difficult to answer because I hope that we do that well. You know, I feel that we do that well. And Be Well's part of that. You know, it's the start of it. The conversations that follow are key. But as I say, it's the actions, and what we try and do all the time is, you said, we did. Very simply, you said, we did. You said you needed this. This is what we've done in response to that. Now we do have some wacky ones. You know, you said you want this. Absolutely not. You're ridiculous. But it comes from somewhere, so you know you have to listen. But it can't be empty. That's the thing. Yeah. It can't be, I'm going to listen and then okay, tick, done that. Now I'll move on to whatever I was doing before. It can't happen. We lose all credibility if we operate in that.
Yeah. I really like that. You said we did. So making the connection, I think, having that loop so that people can see the effectiveness.
I was just going to say, on a very micro level, it is that point. about feeling listened to, even if you disagree or say, I can't do this. So from time to time, I'll get a letter from a child or a young person. And I've said to my team, if it's from a child, I want to personalise and write back myself and make sure that it's sort of hand signed and whatnot. And actually, and sometimes it is saying, no, I'm sorry, I can't do that, or I disagree with you on this particular issue. But time after time, just the feedback that actually a politician listened to me and engaged with me absolutely blows that child away. And then I'll hear from the parents say, thank you so much, it made little Johnny's day that you wrote back. So it's that sort of very micro level, but it's about making sure that you're listening. And I think that goes for everyone. It's not just about children, it's about adults, right? We want to feel like we are actually being heard, even if we don't always get what we want at the end of it.
I think the other thing as well, to make sure that the action that follows, is signposting school leaders to what they can do. So you've got this information, then they can say, oh, well, what do I do? What are my first steps with that? So it's utilising things that are already available. BWell's brilliant at saying, okay, if this is what your data is showing, then there are these opportunities available. These are the partners you might want to work with. And we're a Beacon Well school with the Youth Sport Trust, and there's a framework that we can operate within there to support other school leaders as to how they can make the next best steps in moving well, leading well, living well, and creating that well school culture. So there are things out there, and it's just, again, being able to signpost people to leaders to say, yeah, you don't have to come up with everything on your own. There are things out there already. We just need to connect the dots.
And that highly collaborative approach, I think, speaks really to the essence of what's being done, starting in Greater Manchester by BWell. We're going to have time for your questions in a moment, but I want to just give you a couple of questions that people have sent in. The first is around that point of activity, actually, which you drew out to me. President of the Youth Sports Trust, who is saying, how is the well-being of children and young people being evidenced against the accountability measures in education? You know, we're top of the table according to the PISA data for reading, writing and maths, but lowest for happiness and satisfaction. How do we get a balance? And how do we get that balance to look at the totality of well-being? And any.
Sorry, I was looking at you. I think part of that is showing the way. We've got some schools out there that are doing some amazing work, and it's about going visiting other schools, looking at other schools, and saying, right, you're doing this. That's amazing. You can never parachute it up and put it in, but you can say, right, I'm going to nick that. I'm going to see if that works within my school setting, and then come and have a look at what we're doing, and just to take those small steps. I think when we look at something like this with a national wellbeing measure, and then how are we going to respond to that? It feels huge. It feels massive. And it can be the smallest of things that we activate, those small action steps that might be the most highest leverage things to make the difference for young people.
And if I just add, from the kind of research perspective as well, thinking about the relationship between young people's learning, that we would measure through the attainment data that we have and their mental health. I think there's a tradition of thinking, in at least some sectors of society, that if you're doing one thing, you can't be doing the other. So if you're working on improving and supporting young people's mental health and well-being, that's time taken away from their academic learning. What the academic research shows really clearly is it's definitely not a zero-sum game. Young people's learning impacts their mental health, and their mental health impacts their learning. And I think there's coming back to the kind of national picture, there's a job for government, I think, to kind of emphasise that with the education community, to kind of free them up. Sue talked before about kind of brave leadership, to free them up to be a little bit braver with actually, well, how do we infuse this kind of work into what's already kind of a limited, there's only so many hours in the day that schools are working with kids. But it's freeing them up to actually make decisions to prioritise well-being, knowing that it's not going to be detracting from their learning, that actually this is a symbiotic relationship.
I'm going to throw in one more question before we come to the room, which again speaks to one of these issues about looking carefully in a more granular way. This is from Linda at Coram Voice. How do you think we should ensure that well-being measures we use capture what children feel is important to them, especially they belong to subgroups that have unique experiences? So children in care, children who've experienced homelessness, young migrants, and nearly mentioned LGBTQ+.
Well, it's probably helpful to kind of wind the clock back a bit to where we started with Be Well. Before we did any survey, we undertook a really extensive consultation process. So we worked with about 150 young people. In addition to people like Mira and others that were part of our kind of steering group, we did workshops with young people in schools across Greater Manchester. We then replicated that in the southern location that we've been working with since 2023. Working with a whole range of young people to understand, we asked 3 basic questions. What does wellbeing mean to you? What influences your wellbeing? And what makes you thrive? And what became the Be Well survey in both of those locations is based on what young people told us, what those young people told us. And we've made sure as we've gone along to try and also prioritise the voices of those, again, who might be marginalised. So we've done a lot of work on the LGBTQ plus front. We've done a lot of work with an organisation called the Proud Trust. In respect to young people with disabilities, we worked with staff and young people in non-mainstream settings so that we could get their insights. The simple answer is we have to ask them. But again, it comes back to the you said, we did thing. Because young people have told us this issue is important, that issue is now covered in the survey. And again, we can't cover everything, right? So we do have to make some tough decisions sometimes. But overall, what we then have is a survey that resonates with young people. They're seeing issues in the questions that we ask that make sense to them, that are important to them. So we just have to do lots and lots of engagement consultation work and then show that we're actually making decisions based on what young people tell us is important.
And of course, some of these more marginalised groups of young people who might feel themselves excluded from sort of broader society are also those who are going to be most vulnerable in terms of attainment and attendance. I'm going to turn to the room now, and I think we've got a question, first of all, from the Fair Education Alliance, all the young people involved. Isra, what's your question for the panel?
My question is on mental health support when it comes to there's been a research what the most effective interventions schools can implement to promote rather than just practicing.
It's a really, really good question. How long have we got? So I'll give you a couple of examples. We've just done separately from Be Well, we've just done completed a big trial for the education, for the Department for Education called Education for Wellbeing. And one of the most powerful interventions there that we saw in terms of its effects was something called Strategies for Safety and Wellbeing. This is a short piece of work that is led by teachers in schools that's basically teaching children and young people strategies essentially to look after their mental health, to engage in behaviours and ways of being that will help them deal with difficult circumstances. And in that trial we found in both primary and secondary schools it was a really effective means of improving young people's mental health. In Be Well, we've done a lot of work with pro bono economics, where we've been looking at more targeted interventions for young people who might be at risk, so not universal, but looking at young people that might be at risk. We've done work with Football Beyond Borders, who are a fantastic organisation who work kind of this brilliant blend of physical activity, social and emotional learning, peer support, and building a relationship with a trusted adult. Our analysis shows not only does it improve young people's well-being, but it also offers really good value for money. We're just finishing off a piece of work with Factory International at the moment, who are a crucial part of the kind of arts and creativity sector in Greater Manchester. Their school programme that works with a whole range of young people, our data shows improves their ability to cope with stress, it improves their life satisfaction. So there's a whole range of things out there. I think the key thing probably is, in terms of the overall message, is there isn't just one thing. There's a lot out there. What we need is data that helps us understand what works and for who, but also guidance for schools to kind of steer them towards, as Sue said, well, when there's this issue, what are the different things that we can try to address it?
Sue, do you want to add anything to that from your own experience in answer to this question?
I think it's a great question and a challenging question. What I'm determined to do is not to let things escalate to that crisis point. So we spent a long time thinking about what our early intervention opportunities are. We're not a faith school, but we work with a group of local monks who come and do some mentoring with some of our young people. We set up our own peer support system through our Guardian Angels programme. Before we then get into group mentoring, counselling, use of external agencies. So we try and move as upstream as we can, you know, to try and help young people as early as possible, because I feel like I'm failing a child if I'm putting them on a CAMHS waiting list that's going to be 18 months long. So the more we can do, the earlier we can do, the better. And we've looked at the social, emotional, mental health needs in our setting, and we've set up what we call our cornerstone provision for those children that might be further up that graduated response and might experience crisis or the need for immediate support. We have the cornerstone available with trained staff available to deal with such issues as well. Our aim there is that we keep children in school, we keep them with trusted adults, and we can support them as best we can to try and then feel safe, to feel happy, to feel ready to learn.
Thank you, Elizabeth. Does that answer your question? Yeah. Any other questions? I'm going to, first hand up I saw with the lady there. Oh, sorry, one more than one. Sorry. Forgive me.
Hi, I'm Ramona. I'm also from education. The question is to Manera. How do you know a solution to improving young people's mental health and well-being cannot be one size fits all solution, and we need to make sure that we're accommodating for every single intersectional element of the child's identity. That being said, acknowledging the role that it plays in the child's well-being, we propose an amendment to the children's well-being in school to introduce a national program for measuring children's well-being. How does this amendment help the issues we've been discussing, and what would it look like?
So, sorry, I didn't catch your name at the beginning. Thanks for the question. So I think I touched on this a little bit before about actually taking what we've done in certain parts of the country and trying to scale that up and roll it out nationally, but allowing that sort of local variation and flavour, because I think gathering that data will help us decide what interventions we need to make. More broadly on wellbeing, through the bill, for example, I proposed amendments to ensure that every school has dedicated mental health support, because not every school has that at the moment. The programme started by the last government I think is only about 2/3 of secondary schools across the country, and there's still a long way to go. So trying to make sure that almost a duty in law, which is funded by national government, to ensure that there is that support dedicated in each school, because it's great to hear what Sue's school is doing, but I know that lots of schools and colleges are getting that money out of their core budgets, which they just don't have, to be able to support young people, whatever their needs are, particular to their background. And so having that dedicated support in each school and having that measurement will sort of make sure that, first of all, there's some provision there, but then we're also measuring the impact that provision and all sorts of other things, both inside and outside the school, are having.
Thank you for your question. I'm going to go with the first hand on start, which is lady in the blue shirt, and then I'll come to. Okay.
Thank you. Solange from Football Building Leaders. Thank you. We worked with you guys. It was transformative for us and the data and the evidence we had. I guess I'm sitting here thinking there's nothing here that I disagree with, and I think probably a lot of people would also share the same sentiment. My question to each of you is, what's one thing that anyone in this room can go away and do to make it a reality that we are measuring well-being at a national level? And secondly, Sue, it sounds like you're running one of the schools and carrying on business.
Well, I mean, we'll keep pushing in Parliament. At the moment, the government's not going to give way. I know my colleagues in the House of Lords are going to be picking up the amendment that I tabled in the Commons, and will be pressing further there. I know Lord Gus O'Donnell from Pro Bono Economics, who's been very involved in it, is going to be involved in really pushing that in the Lords. But I can't promise it's going to become law soon. But I mean, that's the nature of this political game, right? Chip away slowly and influence things over time. So even if we can't make it into law this time round, hopefully we've done some of the groundwork to get closer to it next time there's an opportunity.
I think for school leaders, one thing would just be to start the conversation with your young people. If you're not lucky enough to be well like Greater Manchester schools have, then how do you know what you're doing is having an impact? So start the conversations would be the first thing I'd do. The second thing is just lift your head up and have a look at what else is going on around, and, you know, and start seeing if there's something that you can think, oh yeah, we could do that, you know, or that might have a positive impact here.
Neil, anything to add to that?
Everything that my learned colleagues said. I think also, you know, write to your MPs, maybe not Maneira, because I think you're already convinced, so that's fine. But, you know, advocate, advocate and push. You all have your own networks and circles of influence, so spread the word. And particularly any connections that you have to youth groups and youth movements, because again, this campaign needs to be youth-led just as much as Be Well itself is youth-led. So we need to kind of keep our eye on that side of things as well.
And to Neil's point about writing to your MPs, we've got a Labour government with a massive Labour majority. If you've got a Labour MP, please email them, get all your friends and young people in your area that you're connected with to email them.
And I would also add, as Salon, that in a way your question speaks to the work that Football Beyond Borders does. You're advocating through your work, and lots of people in the room, I'm sure, are doing the same. Gentleman with the glasses, just next to the microphone, conveniently.
There we go. Could I just thank the panel for a really deep and reflective conversation this morning, which is really amazing about all sorts of things. I guess mine's possibly more of an observation, but I was sort of struck by the subtitle today of Why Children's Wellbeing, which was in the discussion about why you start scripting words out or saying why children's wellbeing matters and why children matter.
Yes.
That point about the purpose or a purposeful life in school and addressing the balance between standards, obsessive focus on standards, and the point that's been made about sort of saying happy and well children who not only belong as sort of building latest keywords, but also matter. I think that would go some way through the issue of wellbeing. I suppose the second point I represent teachers who are impressed by what you're doing in your school, but also about the up to yourself. I think we also need to address the point of head teacher and leader wellbeing.
Yeah.
Because the reality is we're not creating well environments for the adults in the schools. The chances of there being well environments for you and people.
And what's your question to the panel?
The question is how do we do that? How do we create what we see? You're clearly thriving in your so what lessons can we learn about how we create a lot of culture for leaders and staff?
Yeah, I think similar to the conversation we've had about with listening to young people, I have to listen to staff. And again, not just a tick box, I've listened to you and I'm going to crack on the same direction that I've been travelling. It's listening and then being, again, brave to make the changes that you feel we're going to have a better impact on staff. I know that if I've got happy staff, I'm going to have happier children. I know that if my staff feel positive about coming into work every day, their attendance is going to be better, children's attendance is going to be better. So you can't do one without the other. But the other thing about how I'm looked after as well, it does come down to different trusts and organisations. I work within a relatively small trust and I'm really well looked after and really well supported. And it comes down to governance as well, and ensuring that governors are taking their role within that. And again, I'm lucky enough that I do, but we formalise that, we make it part of that Well Schools framework where there is a governor or a trustee that is appointed to look after the wellbeing strategy or the wellbeing of children. And when we look at the point of belonging, I think belonging is something that people talk about a lot, but is there a lot of thought that goes into how that's realised? We've spent a lot of time this year putting together a belonging strategy. It doesn't sit alone, it sits with wellbeing strategies, safeguarding strategies, attendance strategies and so on. But actually having some real thought about what that looks like and how that feels on a day-to-day basis is really important, not just for children, for staff as well. Because if we're all in it together, we're stronger together, and we know that children receive the better outcomes as a result. And when I say outcomes, I mean from a wellbeing perspective as well as an academic perspective as well.
I was in a school in the Northwest yesterday where I was impressed to see in the staff toilet posters encouraging people to speak up openly about their mental health, but also to hear that they've replaced appraisals with a coaching approach and a coaching mindset
to helping people thrive as well as do their job well.
Sorry, I've gone again, but there's other things that schools are doing well, like offering flexi days, flexible working, counselling support for staff that may have their own mental health issues, physical health support. There's lots of things that can be done relatively easy, and I know loads of schools are on the path to doing that, but a big one as well is obviously looking at the contact time that teachers have with young people as well, so they can do this wraparound work.
So I'm going to go to two people at the front, the lady in the blue dress, if you're waiting a long time, and then I'll come to you.
Hi, good morning. I'm Amy Costello. I represent Spokane. We work in the area of persistent absence and severe absence and families pushed into margins as a result. I'm really interested in lived experience. My children became persistently and severely absent, and then not being on the starting primary school. So I've been through constant screenings and assessments and surveys where we had to report. And what was really interesting was how I noticed that my children stopped giving up in actually reporting accurately in surveys just how bad things were, because they realised actually that they were worried about the impacts that it would have on their parents or on themselves. So I'm interested in how confident you are that children are self-motivating their experience, but also how do we ensure that we're capturing children who aren't in school, so therefore their voices, when they're not attending and actually they're outside the system, can be captured. And my final question, there's 3 in it. We're advocating for mental health and wellbeing school absence code. I think that that's really important to capture that data early, so we're not relying on any surveys, really important early surveys. I guess my question to the panel is whether or not really that would be interesting because and abuse, because we know that if a parent is reporting in an early or emergency,
So Ellie, for the purposes of time, I'm going to focus on the first 2, if I may, which is the importance of authenticity in the voice, that you're not just gathering what they think you want to hear, and inclusiveness of children who are not in school.
Absolutely. So on the first point, I think again it comes back to the way in which we engage with young people in the Be Well approach. So all the information that goes out to schools that then young people see really reinforces the fact that, first of all, their individual data is never going to be seen by a teacher or whoever. It's the data, the way that we feed back to schools and the way that we provide our data dashboards isn't at the individual level. So young people, we can give them that reassurance that you can provide authentic responses, safe in the knowledge that we're not then going to take that data and go to Mr. Smith, the geography teacher, and say, this is what he's put there. So and they get a reminder pretty much every page on the survey as they go through. It's all done online, so they're getting this constant reminder and all the guidance that we give schools to give to young people before the survey that reassures them that your responses at an individual level, the only person that's ever going to be able to connect your name to your responses is one of our data managers, a chap called Lawrence. He's the only person in the whole kind of Be Well universe that has the kind of infrastructure to be able to work out what John Smith in year 7's response on this particular item says. So we reassure young people that's the case. We've done qualitative work with young people previously to better understand their experience of completing these kinds of surveys and concerns about privacy and things like that. And that's what feeds into our strategy to do that. So it's based on trial learning. To your point about young people who are not in school, we want to be as inclusive as we possibly can. So our starting point was we're not just going to work with mainstream secondary schools, we're going to work with APs, PRUs, special schools, but we've also conscious that many young people aren't in school. We piloted last time round, so in the autumn of 2024, we piloted on the South Coast location, in the HIPS location, an electively home educated survey. So via the organisations that are advocating for families and young people in that part of the country, we made a version of the survey open to them. Again, we did some consultation to make sure it was covering issues that matter for them. We weren't amazingly successful, if I'm perfectly honest. The number of responses wasn't great, but that's just kind of strengthened our resolve, if I'm honest as well, that like, okay, we desperately want to reach all young people. You know, the fact that they're not in school, in my view, shouldn't be a barrier to them having their voice heard. So we're going to go again, and we've got meetings set up starting in the spring with our colleagues in HIPS to work out, okay, we weren't successful last time, what could we do differently to improve the response rate when we go again in autumn of 2025.
And it's great to hear that intent behind it, to reach those harder to reach voices. And a question from the front.
My name is David Hoare, I'm chair of a small multi-academy trust in 5% project in Britain. It seems to me, and I'm the private world, the data is clear. We've got very happy kids and unhappy kids don't learn. So I'm really thrilled about developing the data, but the facts are clear. Now, most of the effort has gone in schools, and our schools spend an enormous amount of time on mental health and disadvantage and so forth. But actually, kids are spending 80% of their time outside schools. 80% of their time outside schools. And the burden seems to always be put on schools and heads and teachers who are some of the most wonderful people I've ever met in terms of purpose. 80%, they're out in the community, they're in their families. And I look at social media as being a massive problem that is hidden in plain sight. I just want to know from the committee what their thoughts are. What on earth we can do about it? What help can we get from government to deal with what I think is a massive?
Thank you.
So
I'm going to ask you, actually.
Yeah, so I think we need to take a public health approach to this issue because that's exactly what it is. Three things: greater regulation of the tech sector, and that starts with raising what we call the digital age of data consent from 13 to 16. The UK is quite out of step with other European countries, and that we're allowing these big tech giants to commoditize our children's attention. I think it's outrageous, and it's something that the Lib Dems are going to be trying to amend through the data bill that's going through Parliament at the moment. We also need to empower young people and their parents and carers through digital literacy and education about how we navigate the online world, but also third spaces, so other things to do. I went to visit West, which is a youth, it's like a massive youth centre in White City run by Onside. I think there's one in Oldham as well, actually. Incredible. Absolutely incredible. It's got some private sector funding, other grant funding, I think a bit of council funding as well, and serving one of the most disadvantaged communities in White City. And time and again, they hear from young people, if you weren't here playing sport, making music, cooking, whatever it is, or we'd be at home in our bedroom on our phones. And so that for me is the sort of overarching approach. Tech regulation, we've got to go in harder, I think.
Sue, do you want to add something briefly on that before we wrap up?
Yeah, it scares me because, I mean, I'm glad I didn't have to show a PowerPoint today. I would have cocked that up, and to know how savvy the children are, I think we need to look at how teachers and school leaders are better educated so that we can then support parents and families with it. But there's a way in which we do this in how we communicate that to young people. We can't, if such changes were to be made, it can't be seen that we're taking away from them. We have to, really communicate that effectively and empower them so that they feel that they understand that this is in their best interest and this is why. But you have got everything else. Yeah.
And that's why I didn't talk about bans.
Yeah.
Right.
You're right.
It's about empowering.
Yeah.
Just to layer on a couple of points, I think, so just to pick up on what Manira said, our data actually shows that really well. So our data, we've done a couple of analyses around young people's social media use. We don't see a direct connection to their mental health, but what we do see is a connection to higher social media use, displacing things like physical activity, displacing engaging with arts, etc. So it's about there's only so many hours in the day, and so if you're on your phone, by definition, you're not at the youth club or out playing football or doing all these other things that we know are really good for your mental health. But the other thing I want to pick up on is we have to bring young people with us. Social media is not going anywhere. It's going to become more and more prevalent in terms of its role in young people's lives. So, you know, we need to have an approach that isn't about drawing that away from young people. It's about teaching young people to get the best out of social media, whilst also having that, you know, we're talking in Greater Manchester Be Well about this idea of finding the balance. You know, social media plays a role in your life, but it can't be the be all and end all. And having things that are there for young people so that they're not sat on their phones all the time. And again, it comes back to what the offer is and making it accessible and appealing to all young people.
I think that's a very good final point. It's about giving young people voice. We've heard how important that is. Co-designing any measures with young people's thinking at the forefront of that. The debate about social media is just one part of that, where, you know, it is undoubtedly also an important part of young people's social lives. It's important to recognise what people get from technology, as well as some of the difficulties, and create the opportunities and safe places and sense of possibility about doing other things, particularly we heard from the most marginalised groups. And what a long debate this has been, starting with that reminder that the Children's Society started measuring young people's wellbeing 20 years ago, and we are only partway through that debate. I think a reality check from Munira Wilson about how long it can take to really shift thinking around issues like this, particularly in the absence of data. Be Well is showing that it can be done, and that's an important part of the debate about what should be done nationally. Thank you to everyone who's joined us online and to everyone who's come here today to be part of the discussion. You're welcome to stay and to continue the conversation. And I'd like you to help me thank our panel. Thank you.